Hello and welcome to Health and Wellness, our special program. I'm Gargi Rawat. Today we're talking about men's health and the role played by hormones. Now, hormones play a powerful role in the body's regulatory system. Proper hormonal balance is essential to maintaining optimal health and plays a crucial role in how one feels. While it's common to associate hormonal disorders and imbalances with women, many hormonal imbalances are seen as signs of aging or even inadequacies in men. And like women, men also undergo changes from childhood. However, most symptoms of aging are actually caused by hormonal imbalances. It's true that as men age, they are more likely to experience male hormone imbalance, but there are other contributing factors as well. Fortunately, male hormone imbalance can be successfully treated. Living a long, healthy life is easy if you know the symptoms and prevention strategies. So today we have with us eminent endocrinologists who can help you understand and manage men's hormonal health. We're joined by Dr. Rajeswari Janakiraman, consultant endocrinology, Manipal Hospital, Yeshwantpur. We're joined by Dr. Durga Prasad Bhimala, diabetes, thyroid and hormonal super specialist, and Dr. V. Sasikumar, consultant endocrinologist, NIMS Hospital, Trivandrum. Thank you so much, doctors, for joining us on this program. It's a very important program to talk about everyone's health and how to manage your health. Dr. Rajeshwari, if I could start with you. Hormones regulate the various systems in the human body. So when your hormones are unbalanced, it can affect virtually all aspects of your overall health and functioning. So how does hormonal imbalance affect men?
It's a very important question. Whenever we diagnose any hormonal problem in a man and tell them, they're very surprised. How can men get hormonal issues? However, when we see the endocrine or hormone system, they have some of the glands like the thyroid, adrenal, or the pituitary gland. These are all same for both men and women. So only the male and female hormone producing glands are different and their functions are different. So dysfunction of any of the glands, whether thyroid or pituitary over or under action, can happen in any person, men or women. And as you said already, endocrine system is a orchestration of well-being of the whole body. All organ systems can be affected.
Right, doctor.
So any like how women can have problems with hormones, similar can happen even in men. But the type of reason.
All right, doctor. So it's important for men to be aware that they too are, affected or impacted by hormonal changes as, they age. And that's something it clearly a lot of men aren't aware of. And so, as you said, they're surprised when you point this out to them. Dr. Bhimala, what are the contributing factors to male hormone imbalance?
Yeah. If you see the rise in the male hormonal imbalance in the recent society, the stress plays a major role. So if we take the stress into picture, our work stress as well as our family stress plays a major factor in increasing the male hormonal imbalance. As well as if you see the food we are eating, we are mostly relying on the fast food. So we don't know what is the oil that is made up of, and what is the quantity of the carbs and the protein we are eating. And all these endocrine disruptors will have an effect on the male hormonal imbalance. And in this COVID era, we have also seen how an infection can affect the hormonal imbalance. So if you ask me, what are the major contributing factors of the male hormonal imbalance in the recent society, I would say the stress and the food we are eating and the infections that are on the rise in the present society will make the hormonal imbalance into peak stages. So we need to take care of our diet and exercise, and the stress levels should be kept in normal limits.
All right. So a lot of factors that can contribute, and stress, I think, is a big issue for various things affecting our health. Dr. Sasikumar, many men don't consider that they could have thyroid disease, even if they presented with classic symptoms. That is, as it is always said, that thyroid diseases are more common in women. What is the reality?
There is absolutely no doubt that this is common in females. It is 8 to 10 times more common in females. The problem in the males is very often the symptoms cannot be attributed to a swelling in the neck, because a thyroid deficiency, which is called hypothyroidism, may present with weight gain or hair loss, infertility, sexual dysfunctions, etc., etc. And also the high function of thyroid or hyperthyroidism, it can produce weight loss, it can present with cardiovascular diseases, it can produce weakening of the bones. So for a layman, it is very difficult to attribute the entire thing to something in the neck. So this is the problem, and therefore very often the symptoms of thyroid in males are. We must remember that the thyroid disease runs in the family. There is a clustering in the family. So if a member of the family has a thyroid problem, maybe a female member, then probably the chance of thyroid dysfunction in the males are also higher. The family clustering is a very important point, and it's a guideline. If somebody has a thyroid problem, we should look at the other members whether they are suffering from a similar problem. It is less in males, true, but it is not uncommon, especially with the iodization. The autoimmune diseases of the thyroid have increased, and we are seeing more and more cases in the male population.
All right, Dr. Janakiraman, men may experience some manifestations of thyroid issues that are unique to them. If you could explain to us what are they?
Yeah, as Dr. Sasikumar said, it is less common in men compared to women. Like, it may be 10 to 20 times higher in women. But other thing also is important. Some of, as already told men present little bit later, because one, they don't think they can get hormone problems. The awareness is not there. The other thing is, in women, they have regular menstrual cycles. So many of these hormones, whether the thyroid or other hormones, they can affect the menstrual cycle. So it is brought to their notice much earlier compared to men, because it takes a few months or sometimes even later to actually figure out that they have something wrong. That is slightly different from women. Apart from this, some of the thyroid problems, like in later age men, if there is a lump in the thyroid bed or the neck, the chances in a woman it is non-cancerous is high, whereas in the men it may be more likely to be cancerous one. The other thing is in hyperactive thyroid, because hyperthyroid, in those patients, we do have some people have eyes popping out or prominent eyes. It is called thyroid eye disease. That is much more common in men, and it is also much more severe in men compared to women. These are some of the features that are unique for men compared to women as far as the thyroid is concerned. And they also do present with hyperthyroid or underactive thyroid, like sexual dysfunction or especially reduced sexual drive. These could also be there. They might neglect it as a stress-related rather.
Right. Dr. Bhimala, are there specific risk factors that increase the chances of men having thyroid problems?
Actually, there is a misnotion in the society that thyroid won't be occurring in the male population. It is predominantly seen in the female population, which is not at all true. If you see, the thyroid problems is seen in the male population up to a prevalence of 15 to 20%. The cause being it is neglected mostly in the male population because of the misnotion, and also the risk factor like smoking. It will play a major role in the etiology of the Graves' thyroid disease or the Graves' eye disease, Graves' orbitopathy. So also the stress, which plays a major role in the thyroid hormone disorders, is seen in the male population predominantly because of the occupational risk. And also the infections, it could be COVID. We have seen the majority of the autoimmune thyroiditis post-COVID era. So all these factors, the stress, smoking and the infection will make the thyroid prevalence higher in the male society compared to the older generation. So it is completely a misnotion that thyroid disorders runs only in the female population. Thyroid population can equally affect the male population, but they can be affected late. So please make sure that whenever you are feeling the symptoms of hypothyroidism or hyperthyroidism, you consult an endocrinologist.
All right, Dr. Sasikumar, now that, we've established that men also experience thyroid problems quite a lot, and it's not just women. Are the treatment for thyroid disorders the same, however, in men as women?
Grossly, the principles of treatment are the same. But that will depend upon, again, what exactly is the problem. For example, if it is infancy, a small child coming with thyroid problem, the manifestations are different. It is very difficult to attribute the thyroid dysfunction to the manifestations. A school child may have short stature, may have excessive weight gain, or poor scholastic performance. So it's so varied that it becomes difficult for a layman to attribute it to a thyroid dysfunction. Pregnancy in females, this is another very important thing. If the pregnancy is planned, very often it is not. It is better to do a thyroid screening before that. Once the pregnancy test is positive, then definitely immediately thyroid function should be done. In most of the hospitals now we have neonatal thyroid screening, but the monitoring and identification of the thyroid disease in the early stage is very important, because it interferes with not only with the growth, not only with the height of the child, but also with the intellectual development. So it is very important. In patients with cardiovascular disease, especially in males, thyroid may be the underlying disease. It can present with irregular heartbeats. It can predispose a patient to develop cardiovascular problems. So the situations are different. But if you look at the treatment, it is mostly the same. The treatment of thyroid disorders are by and large simple. In thyroid deficiency patients, you have to supplement the thyroid hormone in appropriate doses, and it can be rectified. A patient with a cardiovascular problem, you will not replace the thyroid hormone tablets in large doses. You will start with a small dose and slowly increase. On the other hand, if the patient has got excessive thyroid function, then probably controlling that thyroid function becomes very important, and to treat more intensively to bring down the thyroid function to normal. So it is not that the treatment is different. It is the situation we have to take into consideration and modify the treatment accordingly. I will say one of the most important situations is the thyroid dysfunction associated with pregnancy. In pregnancy, thyroid function has to be monitored very, very closely. It not only affects the mother, but also affects the baby. So it is very, very important that thyroid monitoring and tests are done regularly in females.
Right. Now, Dr. Janakiraman, just like females, men also prefer to suffer in silence, as it's very difficult for men to come to the doctor for hormone disorder problems. They don't even know what it is. And if you could explain to us the various issues that are caused by this, and whether, it's because of imbalance or the genetic disorders.
See, when we come to erectile dysfunction, there are so many reasons why it can happen. Especially with the psychosocial stress is a very common thing currently. Apart from this, the other common things are diabetes or any disorder which can affect the nerves or the blood circulation. These can cause erectile dysfunction. These are very common causes, what I'm saying. So, of course, diabetes also we treat it, and very good control and preventing the nerve damage or blood circulation, improving it with medications like cholesterol medicines or blood thinners. These we usually do for our diabetes patients. These take care of their erectile dysfunction, most of these patients. However, when it comes to other hormonal functions, when you say, it is usually, most of the time it is not genetic. When we say it is genetic disorder, there are two things we might think of. One is from birth, that is congenital. It may not always be related to genes. Other is the gene related. So congenital, sometimes they are born with some deformity in the genitalia. So that can be caused as, considered as a genetic or a congenital, but chromosomal abnormalities directly do not cause just a functional problems. There are structural or even sometimes the hormone development or the hormone action may be affected due to genetic disorders. So these will have erectile dysfunction. As you said, patients, they may feel very difficult to come to a doctor for this function. Sometimes it's the spouses who actually come and ask us to help out. Apart from this, when hormones are causing the erectile dysfunction, there is one more thing. They see that their sexual drive is very much reduced and fertility is again reduced. So when the only erectile dysfunction is their sexual drive is most of the time normal, probably it is not hormonal, but any person with erectile dysfunction should be investigated because it has much more implications beyond that. Because if, for example, we had a patient with a pituitary tumor having erectile dysfunction, so it's very important to remove that because it was affecting his vision. Left alone like that, it would have affected. So there are thyroid dysfunction, again, treating not just for erectile dysfunction, cardiovascular, it has other implications also. So when hormone is the cause for it, definitely, erectile dysfunction is one of the things, that can happen, and it has to be thoroughly investigated, including the hormone, diabetes, psychosocial stressors also have to be looked into.
All right. Well, we'll slip into a short break now and return with more questions for our doctors. We're talking about how hormones can impact male health. Stay with us. Welcome back. You're watching Health and Wellness, and today we're talking about male health and the role that hormones play in keeping us well and healthy. Let's go across to our doctors. And Dr. Bhimala, as men age, there's a slow progressive decrease in testosterone production. Can a decrease in testosterone levels cause metabolic disease in males?
First thing to be noted is that testosterone is a male hormone and it decreases with aging. And there is a common myth in the society that testosterone is only for the sexual functioning. That is, whenever there is an erectile dysfunction or there is a problem with your erections, you will consult a doctor for the treatment of the erectile dysfunction, which is not at all true. Testosterone is not only for the maintenance of your sexual functioning. If you lose your testosterone in your body, then your body architecture will be slightly deranged. You will be gaining more fat, you will be gaining tummy, and you will losing your muscle. And at the same time, your bone architecture will be damaged, that the bone mineral density will be decreased. So by increasing your adiposity, there is higher chances of getting diabetes mellitus or hypertension. And also the cardiovascular health is also dependent on the male hormone testosterone. So whenever a patient is aging and the patient is having decreased energy levels or the patient is having increased adiposity, make sure you consult an endocrinologist so that he can go for a check of your routine testosterone. So the point to be noted is testosterone is not only for the sexual functioning, but it is also very, very useful to maintain your body architecture and also the bone health. So if at all you fall, you won't be having this trivial fracture. So that is more important. So make sure that you get a check of the testosterone in the aging male whenever you are facing these decreased energy levels.
All right. Dr. Sasikumar, please give tips to men of all ages to avoid hormone imbalance. And of course, one of the key points would be to create more awareness through shows like this. But yes, do tell us.
Probably the most important cause for reduction in the hormone levels is aging. You cannot do much about it. But once you have a problem, it is better to get investigated and find out what exactly is the problem. It may be, as already mentioned, it may be a sexual dysfunction, it may be a thyroid dysfunction. All these can be identified and treated effectively in all the patients. Aging is the process by which all the biological functions decline, and hormones are no exemption to this. Probably the most important tip as far as the hormonal health is concerned is overweight, obesity. Obesity is slightly different in our population. Obesity is not the number of kilos you have. Probably what is important is your waist circumference. Your BMI, weight in kg, they are not important. In our population, it has been found that the waist circumference is the critical factor. Waist circumference increased, or a person has a huge tummy, means there is increased adiposity, increased accumulation of the fat in the abdomen and also the abdominal wall. This is not benign tissues, this is not a cosmetic problem. This abnormal fat tissue acts as a big source of various inflammatory molecules, various hormones which has adverse effects. So obesity is a big problem. In our country, we have a nutritional paradox because in children in our country, there is some 38% of the children are malnourished, and childhood obesity is significantly high. Some studies have shown that in 10 to 15% of the school children, there is childhood obesity. So where should your correction begin? It should be at the early stage. There should be importance for appropriate physical activities and appropriate correction of the diet. ICMR study has shown that we take huge quantities of carbohydrates. About 65 or 75% of our diet is constituted by starch or carbohydrate. This has to be minimized. Therefore, the recommendation is to keep the carbohydrates below 50%. So, prevention of obesity is important not only from the hormonal point of view, it is very significant from the cardiovascular disease point of view, diabetes, neurological problems, so on and so forth. So, keep the weight appropriate by proper adjustment of the diet and proper physical exercise. That is one way of preventing hormonal imbalance.
Right. Dr. Janakiraman, finally, can hormone imbalances or deficiencies lead to poor bone density or reduced muscle mass in men? And what should they do to overcome such conditions?
Yeah. Now, apart from the testosterone, there are other hormones that can affect the bone density also, both in men and women. Actually, so most important in men will be testosterone, of course, for the muscle mass, especially so. However, as already Dr. Bhimala said, small things like tripping and falling from a standing height should not cause fractures in both men and women. However, if such a fracture happens, it has to be investigated for looking at whether there is any thyroid problem, excess, usually thyroid hormone excess, or other gland called parathyroid, which usually controls the calcium metabolism. If there is excess of that hormone, of course, male hormone is reduced due to whatever reason. These are some things which can cause, weakening of the bones.
Well, we're running out of time now. Thank you so much, doctors, for joining us on the program to talk about this important issue and to create awareness about male health and hormones. It's something everyone needs to be aware of. Thank you for watching at home. Goodbye.